Welcome to the deep dive. Today we're tackling a really common thing, something loads of dog owners will eventually face. Osteoarthritis.
That's right. Often just called OA or sometimes degenerative joint disease.
And the numbers are pretty striking, right? Something like 1 in 5 adult dogs in the US deals with this.
Yeah, it's incredibly common. And, it's essentially about the joints wearing down over time.
Okay, so break that down for us. What's actually going wrong inside the joint?
Well, think about the ends of the bones where they meet in a joint. They're covered in this super smooth, slippery stuff called cartilage. It's like a cushion.
Acts like a shock absorber.
Exactly. And it lets the bones glide past each other really easily. But with OA, that cartilage starts to, well, break down. It gets rougher, thinner,
Yeah.
and eventually you can get bone rubbing directly on bone.
Oof, that sounds unpleasant.
It is. It causes pain, inflammation, stiffness. The body might even try to compensate by growing little bony bits around the joint bone spurs or osteophytes.
Right, trying to stabilize things maybe.
Kind of, yeah. But it often just makes things worse and restricts movement.
And the tricky part you mentioned is that this can be happening for a while before we even notice anything's wrong.
That's a really key point. Cartilage doesn't have nerves. So in the early stages, as it's degrading, the dog might not show obvious pain.
Wow, so it's sneaky.
Very. The pain usually comes later when the underlying bone is involved or the joint capsule gets stretched and inflamed.
Gotcha. So which joints are the usual suspects here?
Mostly the high-motion weight-bearing ones. So hips are very common, elbows, knees, the lower back, even the wrists or carpus.
Makes sense, the ones doing all the hard work.
Pretty much. And just to be clear, we're focusing today on this wear and tear OA, not the less common types caused by things like infections or immune system problems.
Right, understood. So this common OA, why do some dogs get it or get it worse than others? It's not just getting old, is it?
Age is definitely a big factor. More miles on the clock means more wear. But it's definitely not just age. A lot of it comes down to how the joints were formed in the first place.
Like congenital issues, things they're born with.
Exactly. Things like hip dysplasia, where the hip socket isn't quite right, or elbow dysplasia. Osteochondrosis is another one, affecting cartilage development. Even luxating patellas kneecaps that pop out of place.
So if the joint isn't built perfectly from the start, it's more likely to wear out faster.
Precisely. Puts abnormal stress on the cartilage. Then you've got old injuries.
Oh, yeah, like a previous fracture near a joint.
Or ligament damage, muscle injuries, even a past joint infection. Anything that's disrupted the joint's normal structure or stability can predispose it to OA down the line.
Okay. What about dogs that are super active, like working dogs or canine athletes?
Yeah, repeated trauma or just very high levels of activity can definitely contribute. It's just more stress on those joints over time.
And then the big one, weight.
Oh, absolutely huge. Obesity is a massive risk factor and probably the most significant modifiable one.
Modifiable meaning we can actually do something about it.
Yes. Extra weight puts simple mechanical stress on the joints. That's obvious. But fat tissue itself also produces inflammatory chemicals.
Really? I didn't know that.
Yes, not just inert padding. It actively contributes to inflammation throughout the body, including in the joints. There are studies showing dramatic improvement in lameness when obese dogs with OA lose weight. It's critical.
Wow. Okay, message received. Keep them lean. Any other factors? Diseases.
Certain metabolic diseases like diabetes or Cushing's disease seem to increase the risk. And then, of course, there's genetics.
Some breeds are just more likely to get it.
Definitely. We see higher rates in breeds like Labradors, German Shepherds, Golden Retrievers, Rottweilers, Bernese Mountain Dogs, often linked to those underlying issues like hip or elbow dysplasia.
Are there like screening tests breeders can do?
Yes. Responsible breeders do screen for conditions like hip and elbow dysplasia using x-rays. It helps reduce the incidence but doesn't eliminate it entirely.
Anything else? Like how a dog is built?
Yeah, body conformation plays a role. How they're put together affects joint stress. Even puppyhood factors matter.
Like what?
Well, some evidence suggests very high-fat, high-protein diets during rapid growth phases might increase risk for elbow OA. And even the environment puppies raised on slippery floors might have a higher risk of developing hip dysplasia.
No way. Slippery floors.
It's thought to potentially affect how the hip joint develops. And one more thing, the timing of spaying or neutering is being looked at more closely too.
How so?
Some studies suggest that removing the sex hormones before skeletal maturity might increase the risk of certain developmental bone diseases, which could potentially lead to earlier OA. It's complex and likely varies by breed, though.
Gosh, it really is a mix of factors then. Nature, nurture, lifestyle.
It really is.
So knowing all that, how do we as owners spot the signs? Especially if it's sneaky early on, what should we be looking for?
Okay, the classic sign is stiffness, particularly after resting. They struggle a bit to get up from a nap or first thing in the morning.
Yeah, that slow, creaky start to the day.
That's often one of the first things people notice. Then there's limping or lameness, favoring one or more legs.
Is it always obvious limping?
Not always. Sometimes it's subtle, just a slight head bob or shortening of the stride on one side. They might also just tire more easily on walks.
Okay.
Reluctance to do things they used to enjoy is another big clue. Not wanting to jump in the car, climb stairs, or hop onto the sofa.
So that sudden lack of enthusiasm for fetch might not just be boredom.
It could well be discomfort. You might see them lagging behind on walks, wanting to cut them short. Changes in their gait, how they walk or run, are also common.
Like that bunny hop thing you sometimes see?
Exactly.
Yeah,
Especially with hip problems, they might run using both back legs together like a rabbit.
right. What else? Any more subtle signs?
Yeah, sometimes they might yelp or seem sensitive if you touch them near a sore joint. Maybe just generally less energetic, loss of stamina. Behavior changes can happen too, becoming irritable, maybe a bit withdrawn, even showing unexpected aggression towards people or other dogs because they're in pain.
That's important to remember. Pain can really change behavior.
Absolutely. Increased sleeping, more inactivity, sometimes even house soiling accidents if it hurts too much to get up quickly or posture properly.
Oh, poor things.
Appetite loss can occur, or sometimes weight gain from inactivity. And some dogs will obsessively lick or chew at a painful joint, like their wrist or
They're
toes.
trying to soothe it themselves?
You got it?
Yeah.
It's really about knowing your dog's baseline and noticing those changes, even subtle ones.
Okay, that's a great list of clues. Now, let's dive back inside the joint for a sec. We talked about cartilage breakdown. What else is going on mechanically?
Right. So, healthy joint, smooth cartilage, joint capsule surrounding it, maybe supporting ligaments, and a small amount of lubricating synovial fluid.
The joint's WD-40.
Exactly. In OA, the cartilage matrix breaks down, loses water content, becomes less spongy, less lubricating.
Sure.
The joint tries to make more synovial fluid, but it's often thinner, less effective. Think watery oil instead of good quality lubricant. As the cartilage wears thin, you get fissures, cracks, and eventually exposure to the bone underneath.
And bone on bone equals pain.
Big time. The bone reacts too. It can become denser right under the damaged cartilage, almost like it's trying to shore things up. Tiny microfractures can occur there too.
Ouch.
And then you get those osteophytes, the bony spurs forming at the joint margins where the capsule attaches.
Which restricts movement.
Yes, and the joint capsule itself often thickens and gets less stretchy, further limiting the range of motion.
So where's all the pain coming from specifically? The bone, the capsule.
It's a combination. Definitely the exposed bone rubbing. Also, the stretching of that thickened joint capsule by the bony growths. Those microfractures in the bone hurt. Abrasion and inflammation of the joint lining, the synovium. And even muscle spasms around the joint trying to protect it can cause pain.
Wow, it's a whole cascade of problems in there. No wonder they feel lousy.
It really explains the discomfort, doesn't it?
It does. Okay, so the crucial part. What can we actually do to help our dogs with OA? It sounds like we can't cure it, but how do we manage it?
That's the key word, management. And the absolute cornerstone, the thing we have the most control over with the biggest impact, is weight control.
We keep coming back to that.
Because it's that important. Reducing the load on the joints is paramount. Plus, reducing that inflammatory contribution from fat cells. If your dog is overweight and has OA, weight loss is the single most effective thing you can do.
Okay, number one priority. What about exercise? Seems counterintuitive if it hurts to move.
It's a balance. Complete rest isn't good, but neither is overdoing it. Light to moderate regular exercise is actually beneficial.
How so?
It helps keep the joints mobile, maintains muscle strength to support the joints, and helps nourish the remaining cartilage. Think short, frequent, low-impact walks, maybe 15-20 minutes, twice a day.
Rather than one long weekend warrior hike.
Definitely. Avoid high-impact stuff, hard running, jumping, sharp turns, vigorous ball chasing on unstable ground. Swimming is fantastic if possible. Great workout, zero impact.
Good tip. Okay, diet. Beyond weight loss, any specific nutrients?
Yes, omega-3 fatty acids, particularly EPA from fish oils, think krill, sardine oil, have good evidence for reducing inflammation and potentially limiting cartilage damage.
So adding fish oil?
It can help. There are also prescription veterinary diets specifically formulated for joint health, often with boosted levels of omega-3s, glucosamine, chondroitin, and other beneficial ingredients, plus they're usually calorie-controlled for weight management.
Worth talking to the vet about those then. What about making things easier around the house?
Oh, loads you can do. Soft padded bedding is a must. Orthopedic beds are great.
Takes the pressure off.
Exactly. Raised food and water bowls up to their elbow height can help if they have neck or elbow pain. Non-skid flooring is vital. Rugs, carpets, yoga mats on slippery surfaces like tile or wood, especially near stairs or where they get up often.
Prevent slips and falls.
Crucial. Ramps or steps for getting into the car or onto furniture they're allowed on. Keep their sleeping area comfy and away from drafts. Keep them warm in cold weather, maybe a coat. Keep them dry.
Makes sense. Cold can make joints ache more.
It often does. Ensure easy access to their toileting area. Keep nails trimmed short for better grip. And for really severe cases, you can get special lift harnesses to help support their weight.
Those sound like really practical helps. What about more formal therapy?
Physical rehabilitation is fantastic. Finding a certified canine rehab therapist can open up lots of options.
Like doggy physio?
Pretty much. Things like underwater treadmills, great for low-impact exercise, therapeutic ultrasound, electrical stimulation, cold laser therapy, heat-cold packs, massage, stretching, range of motion exercises.
What do those therapies achieve?
They aim to improve joint health, build supporting muscle mass, relieve pain, reduce inflammation, and maintain or improve flexibility. It can make a huge difference to comfort and mobility.
Okay. Now, supplements. The shelves are full of them. Glucosamine, chondroitin.
Yes, those are the most well-known. Glucosamine and chondroitin sulfate are components of cartilage. Omega-3s, as we mentioned. Others include MSM, green-lipped mussel extract.
Do they work?
The scientific evidence is variable. Some studies show benefit, others are less conclusive. They're generally considered safe, but they're slow-acting. You might need weeks or months to see an effect, if any. Things like turmeric or boswellia are also used for anti-inflammatory properties. Bone broth is popular too, maybe more as a preventative.
So maybe helpful, but not a magic bullet.
That's a good way to put it. If you try them, look for the National Animal Supplement Council Quality Seal. It indicates the manufacturer follows certain quality standards.
Good tip. What about things like acupuncture or massage?
There's a lot of positive anecdotal evidence for both. Many owners feel acupuncture helps manage their dog's pain. Massage can improve circulation, relieve muscle tension around sore joints, and might release endorphins, worth exploring potentially.
Okay, and then we get to medications prescribed by the vet.
Yes, and this is crucial. Only use medications prescribed by your vet. Never give human drugs.
Absolutely. So what are the mainstays?
The first line for pain and inflammation is usually NSAIDs, non-steroidal anti-inflammatory drugs. There are several licensed for dogs like meloxicam, carprofen, grapaprant, firocoxib. Your vet chooses the best fit.
Are there side effects?
There can be, yes. Potential for stomach upset or effects on kidneys or liver, which is why vets often recommend regular blood tests to monitor things, especially with long-term use.
Okay. What if NSAIDs aren't enough or aren't suitable?
Corticosteroids are more powerful anti-inflammatories, but they have more potential long-term side effects like increased thirst and appetite, immune suppression, muscle wasting. So they're usually used more cautiously, maybe for flare-ups or when NSAIDs fail, and never use NSAIDs and steroids together.
Got it. Any other pain meds?
Yeah, vets often use what we call multimodal pain relief, combining drugs. So things like gabapentin, tramadol, or mantidine might be added alongside an NSAID, especially for chronic or severe pain.
Targeting pain from different angles.
Exactly. There are also injectable medications called chondroprotectants, like Adequin in the U.S. or Carprofen in other countries. These are thought to help protect cartilage and support joint fluid health.
And isn't there something newer, an injection?
Yes, monoclonal antibody therapy. Librela is the one for dogs. It's a monthly injection that specifically targets something called nerve growth factor, which is involved in pain signaling. It's shown great results for OA pain relief in many dogs.
Wow, that sounds promising. So lots of medication options, but always through the vet.
Always.
Is surgery ever considered?
For severe cases, yes. Options range from arthroscopy keyhole surgery to clean up debris to procedures to correct underlying deformities. Sometimes joint fusion, arthritis, for very unstable, painful joints like wrists or ankles, or joint replacement, most commonly total hip replacement. But elbow and knee replacements are sometimes done too. FHO femoral head ostectomy is another option for hips.
Okay, so surgery is usually for more advanced or specific situations.
Generally, yes. It's usually considered when pain isn't managed well by other means.
This is a huge range of management strategies. Thinking earlier, can we do anything when they're puppies to try and prevent or delay OA?
Yes, prevention starts early. If getting a purebred pup from a breed known for joint issues, choose a breeder who does health screening, like hip and elbow scores.
Responsible breeding.
Crucial. Then don't overfeed puppies. Aim for slow, controlled growth. Overnutrition can contribute to developmental bone problems.
So no chubby puppies.
Exactly. Keep them lean. Also, avoid excessive high-impact exercise while they're still growing and joints are developing. Gentle, appropriate exercise is fine, but not forced running or lots of jumping.
Sensible exercise.
Right. Provide a good quality, balanced diet. Ensure they have comfy, supportive bedding. And maintain that lean body condition throughout their entire life. That's probably the biggest preventative step after genetics.
And the spay-neuter timing thing again.
Yeah, discuss it with your vet. For some breeds, there might be benefits to waiting until they're fully mature skeletally, but it's an individual decision based on breed, lifestyle, and other factors.
Okay, lots to think about right from the start. So what's the long-term picture for a dog with OA?
Look, OA is progressive. It doesn't go away. But, and this is a big but, with good, consistent management, most dogs can live a normal lifespan with a really good quality of life.
That's reassuring.
Their activity might need to be adjusted over time, and treatment plans often need tweaking. Regular vet checkups are key. But the goal is comfort and mobility, and that's achievable for most dogs. It's definitely not just a case of, oh, he's just getting old, there's so much we can do.
That's a fantastic point to end on. It's not inevitable decline, it's a manageable condition. This has been incredibly helpful, thank you. Really demystified a complex topic.
My pleasure. Happy to help shine a light on it. It affects so many of our canine companions.
Absolutely. And just a reminder to everyone listening, this deep dive is for educational purposes. If you have any concerns about your own dog's health, stiffness, or mobility, please consult your veterinarian.
Yes, definitely. They can give you an accurate diagnosis and work with you to create the best plan for your specific dog.
This chat isn't a substitute for that professional advice. So, final thought. Maybe just encourage everyone to be really observant. Watch your dogs closely. Those subtle changes in how they move, get up, or play can be early signs.
Great advice. Catching it early makes management much more effective.
Couldn't agree more. Thanks again for joining us.
Thank you.
And thanks to all of you for tuning into The Deep Dive. We'll catch you next time.